Hey everybody, it is Nurse Eunice with Florida Training Academy, and I have so missed you. Tonight we're going to be doing a practice quiz to help you pass the CNA examination. And as we do in each of our videos, we'll give you about 10 seconds to receive your notifications, and we'll get started shortly. Congratulations to everybody who's in the chat who's already telling us that they have passed their exam. So congratulations, everybody. All right, so let us get started. Number one, how can you assist a resident who has difficulty standing in the shower? Is it A, have them sit on a shower stool? B, hold them upright during the entire shower? C, use a handheld shower head to avoid standing? Or D, give them a sponge bath instead? And yes, we're starting off easy tonight. We're going to ease our way into it. And of course, if you need more practice questions, go to fltraining.com. Click on resources and then go to study guides and more. And you should see a free CNA exam packet, which will have the NNAAP exam, also the Prometric exam, and one of my personal exams. So let's see what the responses are. And yes, Gretchen and Danita and Sebony and Diana, you have it correct. Hi, Stephanie. You have it correct. That was easy. It is A. A shower stool provides stability and reduces the risk of falls, making the showering process safer and more comfortable for your resident. And now, don't you forget that in your hospitals, because we're not sure exactly where you're going to be working. So home care, of course, you need to follow the care plan. Hospitals usually have to specifically have a doctor's order in order for your patient to shower. And then if they have IV lines or tubings, you need to be speaking with your nurse so that she can help you wrap those tubes up, because we can't afford for those items to get wet when they're in the shower. But some patients are allowed to shower, whether they're in home care, a nursing home, or a hospital. Question number 2. A patient with a nasogastric or NG tube should be positioned in which of the following ways to prevent aspiration? Is it A, flat on their back, B, Fowler's position, C, supine position, or D, Trendelenburg position? And then I want to pause because Rahel, congratulations. And then I think it was Danita. There are so many of you all responding. Danita also passed her test. So congratulations. And Gretchen is still waiting on a test. So, all right, everybody, let's see what the answer is. Somebody with a nasogastric tube. They have a tube going from their nose down into their stomach. How do you want them positioned? And if you chose B, you have it. You are right. So the Fowler's position helps to prevent aspiration by keeping the head elevated. It reduces the risk of the gastric contents from coming back up and entering the airway. So usually if somebody has a nasogastric tube, if you do lay them flat, you don't lay them flat for long. They're usually up at about 30 degrees. So they're kind of sitting up, but not too high, because we don't want to add extra pressure to their tailbone. All right, question number 3. What is the most important reason for using proper body mechanics when moving patients? Is it A, to avoid injury to the patient, B, to reduce time and effort, C, to comply with facility regulations, or D, to prevent muscle strain and injury to the healthcare worker? Ding, 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 ding. Yes, Danita and Naomi and Sephora and 242 Mama, 70 and Shelda, you have it right. It is D. We want to prevent muscle strain and injury to you. So make sure you're using proper body mechanics. Lift with your legs, not with your back. And don't be afraid to ask for help from another CNA or a nurse. Question 4. When measuring a patient's blood pressure, which of the following actions should be avoided to ensure an accurate reading? Is it A, positioning the arm at heart level, B, using a cuff that fits properly, C, having a patient sit quietly for 5 minutes before the measurement, or D, taking the measurement over clothing? And again, that question asks which should be avoided. So that means there are 3 correct and 1 wrong answer. Which is the incorrect answer? Which should be avoided? And yes, you all have it. For this practice test, it is D, but let me tell you about our patients with frail skin, our elderly patients. Sometimes you put that blood pressure cuff on their arm and it gets so tight it leaves these welt red marks. In that case, you may want to put a washcloth or maybe keep the sleeve of their gown down and you can put the cuff on top of their gown or that washcloth. But if you don't have that person with frail or fragile skin, taking the measurement over the washcloth can lead to inaccurate readings as it can interfere with the cuff's ability to accurately measure the blood pressure. But if I have an elderly lady who's screaming because I'm taking her blood pressure, that means that the blood pressure is going to be accurate regardless because now she's in pain. So in the real world, we use a washcloth. But for your test, never use a cloth or any clothing if you're trying to take a blood pressure because it can alter the reading. Question number 5. Which of the following is a sign of hypoglycemia in a diabetic patient? Is it diaphoresis, bradycardia, hyperactivity, or polyuria? I missed you all. Oh my God, 2025 came in like a beast. I haven't been able to get back on here to see you all, but I'm so proud of you. And let's see what answers you have for question number 5. I see you all over the board. I have A's, D's, B's, and now I have C's. All right, so let's talk about it. Hypoglycemia, that means hypo is low. If you you low on money. So hypo is low. Glycemia refers to the sugar in the bloodstream. So this person has low blood sugar. They're a diabetic. What's going to happen? It is not B, C, or D. So everybody, Jean, Suzanne, you are correct. Latifatu, I hope I pronounced that correctly. It is A. It is diaphoresis. And so diaphoresis is another way of saying that your patient is sweaty due to a medical condition, not due to exercising. So diaphoresis or excessive sweating is a common sign of hypoglycemia, along with symptoms like shakiness and confusion. Our next question, everybody, question number 6. When helping a resident with limited hand strength to brush their hair, what is an effective tool to use? And for this one, it could be brush or comb. Is it A regular hairbrush, B, a wide tooth comb with a built-up handle, C, an electric hairbrush? I don't think I've ever seen such a beast. Or D, a small travel size comb? Your patient has arthritis, they have a limited hand strength, but you want to encourage them to do as much as they can. What would be the best utensil or instrument for them to use? And everybody has it right. It is going to be B, a wide tooth comb with a built-up handle. So that's going to allow for better grip and it's easier for residents with limited hand strength to use. Question number 7. A patient complains of being lightheaded. What should the CNA's first action be? Is it A, administer nitroglycerin, B, reassure the patient and stay with them, C, call for help immediately, or D, take the resident's or patient's vital signs? They're lightheaded. You know you need to do something. What's the first thing you should do? I see D's, I see C's. You all are torn between the two. It's like even, it's neck and neck. You're racing. Everybody remember, a CNA assist. So you need to call the nurse who can call the doctor to get some orders. So if your patient is dizzy, you're going to be doing C. They are lightheaded. If you take their vital signs and they're dizzy because they're bleeding out, their blood pressure is low because they don't have any blood, it's all on the floor. No, you need to be calling the nurse. So the response is C. Call for help immediately. That is the priority to ensure the patient receives prompt medical attention for a potentially life-threatening condition. And after you call the nurse, That's when you can start doing the vital signs and taking the blood pressure, etc. And of course, the scenario I used, the person was bleeding. You can apply pressure also, but you need to be calling that nurse so we can get our other team members in the room. Question number 8. Which of the following is the primary purpose of using anti-embolism stockings? In other words, TED holes, those thick white stockings. Why do we put them on a patient? Is it A, to provide warmth, B, to support weak muscles, C, to reduce swelling in the legs, or D, to promote venous return and prevent blood clots? Oh, this is tricky. Ooh, what do you think? Miss Bonita says D. Fiona says D. Young says C. Prophet Louisiana, I think I said it right, is C. I see a lot of C's, and right now the D's have it. So if you chose D, it's not that C is wrong. It's just that D is the best response. So whenever we put those TED holes on a patient, the anti-embolism stockings, when we say promote venous return, when they stand up, the blood drops down. Blood is in their legs. Venous return means because the stockings are so tight, it's going to help circulate that blood, to keep it into the system, to keep it circulating. That helps to also prevent blood clots. And so that's why we want those patients in their TED holes whenever they stand up. Otherwise, well, before they stand up, otherwise, once they are standing, those legs starts to swell because all of that blood is just pulling in their legs. And so put those TED holes on before you get them up and before they start ambulating about the facility. And now, as I said before in the very beginning, if you want free resources, you can go to our website, which is fltraining.com, click on the resources tab, and then you're going to see study guides, practice tests, flashcards, videos, and more. And look, she's pointing at it. The free printable Prometric and NNAAP CNA sample test. If you click on that, you will be able to download free practice tests so that you can practice with pen and paper and not just with our videos. All right, so let's go to our next question. Question number 9. When assisting a resident with ambulation after surgery, which of the following is the most important safety measure? Is it A, providing the patient with pain medication beforehand? B, ensuring the patient wears socks? C, using a gait belt for support? Or D, encouraging the patient to move quickly to build strength? When assisting the patient with ambulation after surgery, which of the following is the most important safety measure? How do we prevent a fall? How do we prevent this patient from hurting themselves after a surgery? That's how I want you to think of this question. And then Abigail, I don't have too many CMA question and answer tests. I do apologize. But for everybody who put C in the chat, you are absolutely correct. We're going to use a gait belt. So using a gait belt, it helps to support the nurse, helps to support the patient, and it provides a secure way to hold on to the patient. Remember, if you're holding on to the gait belt and they start to get dizzy, you can pull them back against you and slide them to the floor. That's not a fall, that's an assist. And so on, you can also be screaming for help, but that gait belt allows you to control their core weight, the weight in their abdominal area, and they are less likely to fall if you use a gait belt when you're ambulating or walking them. Question number 10, which of the following task is appropriate for a nursing assistant to perform when caring for a patient with a urinary catheter? Is it A, inserting the catheter, B, measuring and recording urine output, C, irrigating the catheter, or D, removing the catheter? And I see you, Shan and JH17 and Miss Benita and Sephora and Stephanie and Hermaine. You all have it correct. And Charm, it is B. And so that is on a lot of the state CNA examination when you have to actually measure and empty the contents from a urinary drainage bag. And remember, what goes out should match what's coming in. So if you have your patient, they're drinking a whole bunch of fluids and the quantity of urine doesn't match what they have going in, that means they're retaining fluid. They're going to retain extra water weight. And if they have congestive heart failure, that is a bad thing. So just think of it. If a patient's drinking a whole bunch, you want to see that much quantity of urine, at least equal amounts, in their bag. Okay, so measuring and recording urine output is a task that falls within the scope of a nursing assistant's duties, ensuring accurate monitoring of the patient's urinary status. And whenever you're looking at urine, you're looking at the color, the clarity, don't forget the smell, and also the quantity. All of that is important because if it's discolored, if it's cloudy, or if it has a smell, that can be a sign of an infection. All right, so our next one, question number 11. A nursing assistant finds a patient lying on the floor. What should be the first action? Is it A, assess the patient for breathing and a pulse? B, help the patient back to bed? C, scold the resident? D, report the incident to the nurse? Or E, A, and D? I'm over here doing my nurse dance. Hold on, let me show you my happy dance. That's the only dance I know. Great job, team. Great job. It is E. It is A and D. Whew. All right, so patients on the floor. You do not get them up by yourself. Patients on the floor, you tap and you shout, hey, are you okay? Are you okay? You're checking on them. If they're moving, they're okay. You hit that code button. Or if you're not in the hospital, you're calling 911. You're getting a nurse in the room somehow. But let's say you tap and you shout and they don't respond. Need to be feeling for that pulse where you're screaming out for the nurse, help. And you may need to start in CPR while you're waiting for the nurse to get there. So that is the difference. If they're responding, they have a pulse, you don't have to start CPR. But if they're pulseless and they're not breathing while you're waiting for that nurse to get into the room, you need to start your high quality chest compressions. Question number 12. Which of the following foods is the best source of dietary fiber? Is it chicken breast, white rice, an apple with skin, or ice cream? And everybody's going to get this right. There's no way you're going to get this wrong. Just as I figured, you all are very smart, great caregivers. And so we know that fruit, especially fruit with skin, it is filled with fiber. So the answer is C. An apple with skin is a high fiber food. It promotes digestive health and regularity, which is essential for patients' overall nutrition and well-being. And if you all are enjoying the fact that I'm reading the questions to you, remember when you take your CNA examination, you can ask for an oral examination. They will give you an audio earpiece, a headpiece, so to speak. And whenever you press play, it will read the questions to you. It will read the answers to you. And sometimes that's all you need to pass this test. It's just a little bit of help with the vocabulary. So don't be afraid to ask for an oral test when it's time to take your written CNA test, okay? All right, so question number 13. Which of the following symptoms might indicate that a patient is experiencing a urinary tract infection or a UTI? And this one's kind of tricky. Is it A, high fever, B, hematuria, C, constipation, or D, decreased thirst? What would indicate a UTI? Fever, hematuria, constipation, or decreased thirst? And we're torn between A's and B's. And so the correct response is going to be B. They more than likely, unless it's like now a kidney infection, if it's just lower in the urinary tract, they're usually not going to have a high fever. They could have a low-grade fever. But what is hematuria? That's when the urinary tract is irritated, the urine can start changing colors. So hematuria, or blood in the urine, is a common sign of a urinary tract infection, along with other symptoms like painful urination and increased frequency. The amount of blood can be microscopic, meaning that you can't see it with your eyes. and that's why we send a specimen to lab. Or it can be gross, meaning that it is a quantity of blood in which you can start seeing the changes in the color of the urine. So that is what hematuria is. Question number 14. A patient with Alzheimer's disease is becoming increasingly agitated. Which intervention should the nursing assistant implement first? Do we want to restrain the patient, administer medication, leave the patient alone, or use a calm and reassuring approach? How do you want to, approach this patient who is agitated, who has Alzheimer's disease? They have confusion. What are you going to do? And they want to know why you are in their house. You're actually in the hospital, but right now they think you have broken in. So what are you going to do? All right, and I see a lot of correct responses. Everybody got it right. It is D. Using a calm and reassuring approach helps to de-escalate the situation and can often soothe an agitated patient without the need for restraints or medication. Question number 15. A patient has an order for NPO status. Which of the following actions should the nursing assistant take? Is it A, remove the water pitcher from the room? B, provide the patient with clear fluids only? C, offer ice chips every hour? Or D, encourage the patient to eat small, frequent meals? So what does NPO mean? Because everyone's getting it right. You know your medical abbreviations. Yay! Chanel, good luck on your exam. We're going to be praying for you. You got this. So everybody, NPO means nothing by mouth. So we need you to remove that water pitcher. Remove the water pitcher from the room to ensure that the patient adheres to the NPO, nothing by mouth order, which is critical before certain tests or surgeries. Look, as much as we love our patients, we know that if we leave a pitcher of water in their room with water inside of it, I could tell them they're NPO because they have surgery tomorrow. The doctor could have told them 5 times and you told them 6 more times. If you leave that pitcher in the room, they're going to drink it. So if you do leave the pitcher, make sure it's empty, and that's going to help make sure that they adhere to their NPO orders. Do you understand why a patient has to be NPO before surgery? Why we can't just give them water? Because they may vomit during surgery. And with the anesthesia, sometimes it can make them sick. Well, at least if they get nauseated and they don't have anything on their stomach, nothing's going to come up. They're not going to aspirate. But if you allow a patient to have water before their surgery, we have to cancel that surgery because it's safest for the patient. Usually they can't have anything to eat or drink after midnight. So thank you for helping us take care of our patients and not having to reschedule surgeries. All right, question number 16. When performing perineal care, hold up, looks like someone passed their test. I must have missed it. I think it's Mugabe. So congratulations. All right, 16, when performing perineal care for a female patient, the nursing assistant should wipe in which direction? Is it front to back to front, side to side, or in a circular motion? Well, one of those is just nasty and 2 are extremely inappropriate. So the correct response is, of course, from cleanest to dirtiest. So it is from front to back. You wipe from the cleanest area, which would be like the vaginal area, towards the rectum area. So wiping from front to back reduces the risk of spreading bacteria from the anal area to the urethra. And a crazy thing I like to say is if you wipe inappropriately, you're putting poop in the coop. Now, it works. It's a way for me to remember it. So make sure you always wipe in the right direction because we don't need fecal matter entering anyone's urinary tract. All right, so let's see what our next question is, everybody. Our next question, question number 17. The nursing assistant is helping a patient with passive range of motion. And we have another person who just passed their test. And of course, we got an evil person who's saying mean things. I'll block them if they keep that up. But I'm just here for a refresher. I passed my exam on the 21st on my first attempt. And Natisha, you are welcome. So question number 17. All right, put that person in timeout. The nursing assistant is helping a patient with passive range of motion. Which of the following is a key principle to follow? Is it A, perform exercises quickly to avoid fatigue? B, force each joint to its maximum range? C, support the joint being exercised? Or D, perform exercises only once a day? And in the future, I will make a few of you all moderators. And then that way, if someone's saying something inappropriate, you can kick them out. All right. So this is a safe learning environment. We don't allow mean people on our side. All right, everybody, you have the right answers. It is C. We're going to support the joint being exercised. So supporting the joint prevents injury and ensures the exercises are performed safely and efficiently. And we have an entire playlist of me doing the CNA skills videos for the prometric exam, which I know those who take the NNAP exam, the credential exam, they've also utilized those also. But if you want to see skills, we have a playlist for you on YouTube, on our YouTube channel, which is at Florida Training. Question number 18. What is the purpose of a bowel training program for a patient with chronic constipation? Is it A, to promote the use of laxatives, B, to establish a regular bowel movement routine, C, to increase the frequency of bowel movements, or D, to enhance dietary fiber intake? A bowel training program. And yes, so many correct responses. It is B. So a regular bowel movement routine. So they're probably going to be on stool softeners. That's number one. Remember, if you're laying in the bed all the time, you don't have peristalsis, your bowels are not moving. So that's why we want to get patients up as often and as soon as possible. Then they need water, they need fluid, and on top of that, they need fiber. So when you think about a bowel training program, and we need to sit them up on the toilet. So by doing all of that, we help to establish a regular bowel movement routine, and it's going to help prevent constipation and promote healthy bowel habits. Question number 19, team. A patient with difficulty swallowing is at risk for aspiration. What should the nursing assistant do to minimize this risk during feeding? Is it A, offer large bites of food, B, position the patient lying down, C, provide thin liquids, or D, encourage the patient to take small bites and chew thoroughly? How do we minimize aspiration risk? Great job. Like 100 of you put D. That is so right. So encouraging the patient to take small bites and chewing thoroughly reduces the risk of aspiration by ensuring the food is well prepared for swallowing. Don't forget to sit them upright and to limit distractions. They should not be eating, watching TV, and laughing, because those distractions can actually increase their risk of aspiration. And something I like to remind you is to make sure that the teeth matches the diet. So if Miss Lucas doesn't have any teeth and she doesn't have her dentures, I don't care what she does at home. When she's in your facility, she cannot eat a hamburger. You're going to have to notify me. Come notify me. Hey, Nurse Eunice, she doesn't have any teeth, but she has a regular diet. Let me go talk to her. Let me figure out where her teeth are. All right, Miss Lucas, where are your teeth? Well, I don't have any. If she doesn't have any, I'm going to have to cut. We're going to cut that burger up really small, whether she likes it or not. And now I have to go out and communicate with the doctor and let the doctor know that she doesn't have any teeth. And more than likely, she's going to be placed on a mechanical soft diet, which means she can probably get a roll and she can get Salisbury steak, which is beef with a lot of gravy, but she's never going to get that compact sandwich with a whole bunch of layers because she's not able to chew it. And that puts her at risk of aspiration. So make sure that the diet matches the dentation. If they don't have teeth, they should not be on a regular diet. Question number 20, which of the following is the best method for a nursing assistant to use when communicating with a patient who has hearing loss? Is it A, speak loudly and quickly, B, use a communication board. C, write down instructions. Or D, speak in a high pitched voice. And I'll take a few answers for this one. What do you think the best response is going to be? All right, so I see a B, I see a lot of C's, and that's what I was thinking. It's somewhere between B and C. So let's see. If someone has hearing loss, how can we communicate with them? And I agree with all of you. It is B's and C's, but a communication board is just the easier way, and I'll show you what one looks like. So using a communication board helps to convey the message clearly to a patient with hearing loss, complementing verbal communication. And here's an example of a communication board. It's like literally yes, no, there's a picture of a pill, a toilet. And so we may use those with people who have language barriers, or if you have a dry erase board, pencil and paper, you can also have them write it down. But either way, B or C, in my opinion, are both the correct responses. Question 21. A patient is on a low sodium diet. Which of the following foods should be avoided? Is it fresh fruits, plain rice, canned soup, or fresh vegetables? Which one is high in sodium? This test was so easy for you all. My next test is going to be hard because y'all got too many of these answers right. Y'all are too good for me. So yes, canned soup or processed foods are high in salt. And so patients who are on sodium restrictions, those with hypertension, cardiac issues, they should not have high sodium food. So question number 22. A patient with CHF or congestive heart failure. And the way I want you to think of congestive heart failure is if this is the heart and it's failing. So remember, the heart pumps blood. When the heart starts failing, guess what it's not doing? It's not pumping that blood. It's just sitting there. It's congested. And so it can back up into the lungs, all that excess fluid, or it can back up into the legs. So now with that thought in mind, a patient with congestive heart failure is experiencing edema. Which of the following interventions is the most appropriate? Is it A, encouraging fluid intake, B, allowing them to eat a regular diet, C, elevating the patient's legs, or D, restricting physical activity? And the crowd goes, wow, because you all have the right answer. Yeah. We need to elevate those legs. So great job. So elevating the legs helps to reduce edema by promoting venous return and decreasing fluid accumulation in the lower extremities. And if you remember from one of our previous videos, I don't have any treats to give you. You just get brownie points by being the first ones to put it in the chat. What are those devices called that we put on the legs? Or what are those stockings called? Do you remember the name? All right. And so whenever they have those edematous legs, we have to help promote venous return. And we're going to put those special stockings on them before we stand them up. Yes, Miss Benita. All right. So Alexander and Benita, they put Ted, Hose, and Naomi. So very good, you all. I am proud of you. All right. Question 23. And then Charm is like anti-embolism stockings. Yes, Charm. All right, so question 23. A nursing assistant notices that a patient's urine is dark and concentrated. What is the most likely cause? Is it dehydration, urinary tract infection, diabetes mellitus, or high protein intake? What would cause someone's urine, usually like a common reason that someone's urine is dark and concentrated? And we're torn between A's and B's. All right, so take dark out. Why would someone's urine be concentrated? Why would it turn orange? Is that a UTI? Or is it dehydration? So yes, everybody who put A in the chat, woohoo, Great job. It is dehydration. So, dehydration often causes urine to become dark and concentrated due to reduced water intake and increased urine concentration. Remember, with a UTI, they have frequency, they can have a burning sensation, they can have microscopic or gross bleeding, hematuria, but usually it's just not dark and concentrated. So, concentrated, they need more fluids. And another fluid they can have besides water is that you can also promote or ask them to drink some cranberry juice too. So that's another option also. All right, question number 24. Which of the following is the most appropriate response if a patient starts to vomit while laying in a non-medical bed? Example, home care. Because in home care, we just can't sit them up because sometimes they don't have those fancy beds. So is it A, do you panic? B, do you place a tongue depressor in the patient's mouth? C, do you turn the patient onto their side? Or D, do you prop the patient up with your hands or a pillow? Patients vomiting, what is the quickest thing for you to do? So proud of y'all. So proud of y'all. Yes, it is C, protect their airway. So turn the patient onto their side. That helps to open their airway and it prevents aspiration. You all are amazing. Question 25. A patient is scheduled for surgery and needs to be transported to the operating room. What is the nursing assistant's primary responsibility? Is it A, explaining the surgical procedure to the patient, B, ensuring the patient remains in PO and that the chart is transported with the patient, C, starting an IV line, or D, administering preoperative medications? And Mars and GH17 and Kadisha and Nothamba and Tabitha and Chrissy and Charm and Judy and Abigail and Tara. It's a lot of y'all. Ashley, Nam, Fiona. I'm so proud of you. I am so proud of you because the answer is B. You're absolutely correct. So ensuring the patient remains NPO and that their chart, even though we may have an electronic record, usually there's some type of paper documentation that's going with this patient to surgery. So make sure it's there with them. That is your primary responsibility, and maybe giving them their bath before their surgery. I think we use like chlorhexidine, some type of anti-infective type soap so that we can make sure that they don't, they're going to be less likely to get an infection. And so those are the critical aspects for a CNA as far as your duties when a patient is pre-operative. And guess what, team? I'm so sad. Oh, is this the end? It's the end for tonight. You all, life has been lifing. And so, but what I like to say is that we've been fighting, but we've been fighting and winning. So for all of my babies who have passed their CNA examinations, I am so proud of you. Give yourself applause. And I'm going to try my hardest to be back on here on Thursday. If I can come back tomorrow, I will, but I'm definitely coming back 2 times this week because I miss you all and I love you all. And I wish you all the best. So you're so welcome, everybody. And keep shining. I'm so proud of you. And I'll see you in the next video. Bye, everybody.